day, everyone. This is Rizwan Buttar, Chief Innovation Officer at INNONATION. We are today. Dr. Shafeeq has joined us. He has the immense experience in managing research centers and medical facilities worldwide, especially in GCC in Africa. And the most interesting part is that he is one of the very few people who has practical experience of tackling, handling, and being in an epidemic very recently in West Africa during the Ebola outbreak. So welcome, Dr. Shabi.
Thank you very much, Rizwan, for having me here.
So we would like to talk upon that your expertise, and since you have been noticing the worldwide spread of the current epidemic, since December, then January, how it went through Italy, how it went through US, UK, and in Pakistan perspective. So what are your candid view on how it is going to be so far and your anticipated view on it?
Well, I think I will not talk much about what happened in China and America and how it spread. Everybody knows it. So no need to spend time on it. But let's talk about what are the lessons learned from Pakistan and what should we do now, and what are the lessons we learned from America and China. Well, uh, if you see, most of the spread so far has been in the rich countries, mostly Western or richer countries. Surprisingly, the poor countries have been, I don't want to use the word spared, but the spread has slightly delayed or slow. Uh, I think the God has given us this opportunity that we can learn from Chinese experience, we can learn from American experience, and the experience of other affected countries. It will come, first of all. It will come to Pakistan. It will come to all the countries, including India and Africa. We should come out of denial that no, it's nothing, it's just a flu, nothing will happen. No, it's not just a flu. And I mean, God forbid, but the fact is, we should not be in denial. We should there are 200 other countries which are affected. So we should learn from them and we should prepare ourselves. Now, I think my calculation says that the peak in Pakistan, it will come around first week of June, somewhere around first week, maybe second week, and it may last for maybe 4 or 5 weeks, whole June, or maybe a small some part of July. And after July, it may or may not come down. You see, we can't say really anything so far because we don't have evidence um, uh, to claim that it will come down or herd immunity will develop. Yes, theoretically it may develop, but what do you know what it means? Herd immunity develops once you have 70% of the population, uh, having the virus. I mean, which means we are talking about 150 million people. You see, that's very scary. But I think that this will peak in June, and it will carry on some part. That the peak will carry on till early July, and then as we have seen in other parts of the world, that the peaks have declined after some time, after maybe 6 8 weeks. But that happened because of the interventions, strong interventions done by the government. I mean, they used lockdowns, you see, and that lockdown is called hammer approach. So the peak was hammered down because of the lockdown. Unfortunately, in Pakistan, we have lifted our lockdown, I think, at the wrong time. I mean, you see, it's going to lift, is going towards lifting. The daily, the numbers are, they are escalating. You should stop it. You should. This is the right time for the lockdown. But anyway, we have some other priorities. But as a professional, I think uh, this is not the right approach, and we should have carried on the lockdown in some way, but it's not there. And So the onus comes to the community itself. So now it's up to us, ourselves. How we can protect ourselves? It's simple. Using mask when we, using mask, number one. Number two, social distancing. These are the two basic, basic preventive measures. These are very, very effective measures for the community. And I think if the government has lifted the lockdown, but they should make mandatory. I repeat, they should make mandatory for all Pakistanis to wear at least a mask. Okay. Um, if they think that maintaining a lockdown is not a viable option and because of the hunger and other things, well, then the only option we have is this mask and keep the social distancing. Although in a Pakistani context, it's really very, very difficult. We know our society. I mean, they will not follow, but at least make them follow strictly follow the rule of wearing a mask. At least there will be some protection. So something is better than nothing.
Okay, so if we talk about the most important thing in this context, because our frontline workers, the healthcare worker, are primarily are fighting this war and are going to
Oh
fight
yes.
this epidemic, and effectiveness of the tools and weapons that they have is very important. So, what are healthcare risks and challenges that our healthcare workers face, and how we can better equip them and better prepare themselves, their facilities, the place of work, their transportation, how they handle the entire ecosystem towards a safe, secure, and preventive methodology.
Well, you need to develop a whole ecosystem, a COVID healthcare ecosystem of prevention. In such a short span of time, I don't see it happening. Although God had given us the opportunity, but I think it's already too late. We just 20 days away. We are from the peak. So in 20 days, no miracle will happen. Anyway, you see, the most important thing is, again, I repeat, is the PPE. You need to give your doctors PPEs, personal protective. You need to give them N95 or PAPR, purified air powered respirators, and coveralls. You see, and the most important thing is you have to give them sanitizers. You see, and disinfectants. There's a whole ecosystem. The one big problem which I'm seeing is, number one, the lack of availability, and even if they are available, the quality is very inadequate. It's very poor. I mean, we are giving our healthcare workers a false sense of security. First of all, the PPs are not there. Even if they are there, those PPs mostly are useless. You see, we are sending our doctors to ICUs and isolation wards in in so-called coveralls, which are made of non-woven fabric and with a spore size of 500 microns. Where you see the virus is 1,000 times smaller than the pore, so it can't stop it. You see, we are exposing our doctors. In fact, I think our at least 10 to 20% of our healthcare force has already been infected. Uh, Daily we need, we get the news that 10 people got, 10 doctors got infected in Balochistan, 5 got infected in Karachi, or on daily basis. And these are your precious soldiers. And I think one professor or one senior doctor is equivalent to one army general right now. One doctor is equal to your army captain at this point in time. So you give your these medical captains and your medical generals, give them arms and real arms. You see, so we are giving them rifles but without bullets. So I think the basic link is missing. You see, we have established healthcare facilities. Yes, expo centers have been used, and there are unused facilities. Agreed. I mean, they are waiting for the patients. But again, our army is not equipped. I mean, they have the guns, but they don't have the bullets. And the bullets which we have given them, those bullets are useless. So I think immediately, government of Pakistan should immediately give high quality PPEs to them, high quality sanitizers to them, and high quality disinfectants. By high quality, I mean at least 80% ethanol should be there in the uh, sanitizers, and the coveralls. They should. I mean, the pore size should be small enough to hold to stop the virus. And similarly, we should give them peppers, the purified air powered meters. With the I mean, we should give them high quality respirators, and this is the only way. There's no treatment. There's no medicine. There's no vaccine.
So if
I
we
mean,
would close this call, this session on a point that if I said top three things that healthcare workers should do and top three things that common man should do so that we can stop prevention, because prevention seems to be the only option,
exactly.
whether the country has resources or doesn't have resources.
Look, we can fight this war. We don't need much money, frankly speaking, to be very honest. We need common sense, and the top few things which we need, which our healthcare workers needs. We need to give them gloves. We need to give them masks. We need to give them coveralls, and good quality coveralls, good quality sanitizers, good quality disinfectants. So these are the top 4 5 things. For the community level, things is very simple. They should also wear mask, okay, although they don't require N95 level or uh, N95 or N99 level, but they should also use simple community mask whenever they go outside. Number one. Number two, they should keep a social distancing, you see, and they should stay away from crowded places. So what I mean to say, we can still win the war, not win the war, but we can still fight the enemy till the vaccine arrives. And during the interim time, honestly speaking, we don't need expensive medicines. We don't need expensive arms. Our arms are very simple: the PPEs and the social distancing, which I think we can do it. We just need a political will and some intelligent decisions.
Thank you for your time today, and we look forward to host you again. Take care.
Welcome. Welcome.